Well, I think some of the reasons are in the need to talk about it, and it's uncomfortable. Again, I can speak from personal experience of that. I've never felt comfortable as a white man talking about race and racism, and I have to. Otherwise, I'm going to be a perpetuator of the status quo rather than part of the change. And I think it's essential, and I think in particular for leaders in our system who have power and privilege to use that in a positive and productive kind of way. But don't expect to feel comfortable doing so, because it's not. These are difficult things to talk about. I think a second issue is that we're often unprepared or unwilling to address issues that go into areas like unconscious bias, institutional racism. They're not concepts that we train in as healthcare leaders. They're things that we have to develop over time through exposure and experience. You don't learn that as you do your MBA. And so we have to talk to people with the lived experience of these things and develop our understanding. And you have to, and again, I think this is difficult for leaders, you have to accept your part in the system. So we all have unconscious bias. I have it just the same as any other leader I've ever met, an individual I've ever met. I've never met a person who does not have some level of unconscious bias.